to the July meeting of the Louisville Metro Board of Health, our last meeting of this term. First, it's with huge virtual hugs and congratulations to Dr. Inder Singhal, whom the mayor appointed as the permanent chief health public health officer, and also to Connie Mendel for her, we'll just say, decades of service. How's that, Connie? With the department, her skilled background, and especially of the inner needs and roles of the public health department, and my supreme partner as we went through COVID recovery. So hats off, and wishing everyone the very, very best that this community can offer. And I know that you will keep people totally engaged. As mentioned, this is the last of this term, and the new term will begin when we convene on September 4th, 2024 at 8 a.m. under the most able leadership of our 2024-2025 officers to be elected at this meeting. First, let me say, with a huge heartfelt desire, that it's been a tremendous honor and opportunity to serve on this board and as your chair, beginning with the city's COVID recovery effort in the late 2019. Your continued engagement, propagation of new public health policy and advocacy, as well as your sharing and use of your networks to help pass laws and regulations whose impact has resulted in better and improved health outcomes. From new real estate rental property registration requirements in areas under-resourced that residents most needed in certain parts of our city, to areas with dangerous levels of air pollution, groundwater flooding, and lead, to improving collaboration and partnerships among the hundreds of community organizations, service organizations, and nonprofits to ensure greater opportunity for these communities. Together, we have positively disrupted public health. The board, the mayors during this period of time, and their administration have allowed me to purposefully, very purposefully, give back to my hometown community that I was so blessed to receive after a long career in the corporate healthcare sector. Both Dr. Bautista-Cervera and I have worked together very closely for a couple years, and I know she will represent with aplomb the communities for whom she's dedicated her Louisville career and life work. And so it is with great pride that I call for your vote for the following new officers. Dr. Patricia Bautista-Cervera as 2024-2025 chair, and Dr. Emerald Echols, PharmD, for vice chair for the 2024-2025 year. Is there a second? Raise your hand.
Second.
I need to see hands, folks. Okay. Is there any, well, let's go to a vote. All in favor? Hands up. Opposed? Abstentions? unanimously saluting the 2024-2025 chair and vice chair. And, oh, I love that.
Excuse me, Chair, we have a special guest with us this morning.
Okay.
Mayor Greenberg has joined us.
Oh, how wonderful. Mr. Mayor, welcome to the last meeting of your current chair. I look forward for the first time in 5 years of being an engaged board member. And I'm happy to pass the baton to Dr. Patricia Bautista-Cervera, who has served with me for several years. And I'm just very proud and very grateful for the greatest opportunity of a lifetime to give back to my hometown community. So thank you. Mr. Mayor, do you wish a few comments?
Just a few. I want to congratulate Dr. Bautista-Cervera, and I'm very excited to continue working with you, as I know Deputy Mayor George is as well. But I just wanted to pop on real quickly, Heidi, to give a special thanks to you. You have been such a tireless advocate for public health in this community for so long. You have served the community so well in your official capacity as a member and then as chair for 4 years. And on the Board of Health. And I just wanted to say thank you. And during probably the most challenging times and important times, arguably in the Board of Health's history during the COVID pandemic, you were there leading the charge, and really lives were saved, lives were improved, our community was improved because of your leadership and your colleagues on the Board of Health, many of whom are still on the board today. And so I just wanted to pop on, and for the first time since I've been mayor, I wanted to do a virtual proclamation presentation that we will get to you officially in person. But I thought it was appropriate to actually read what is on the proclamation. I usually don't do this, but if you guys will bear with me for 45 seconds.
You are embarrassing me for
I know, but I thought I could virtually
reasons.
embarrass you easier than I could in person, so I'm going to read it.
Okay.
As we pay tribute to a compassionate soul who is devoted to making our city and state healthier and safer for children and their families, Heidi joined the Board of Health in 2018 and has been a trailblazer ever since. In 2020, she was thrilled to lead as the chair of the Board of Health for the past 4 years. Among Heidi's many accomplishments, she has helped raise $25 million from the private sector, both financial and in kind, to help our city with the COVID-19 response. Introduced monthly educational perspective sessions to the board meetings so the Board of Health could hear from public health experts and community partners. Added advisory members to the board to include representatives from key community organizations, and secured funding and flu vaccinations for JCPS students in underserved communities. Today, our city joins the members of the Board of Health in celebrating a staunch public health advocate who continues to dedicate her service to ensuring the safety and well-being of Louisville residents. The city will be forever grateful for Heidi's leadership and unwavering commitment to public health. So thank you so much, Heidi. Thank you for what you've done. I'm excited to continue working together with you for years ahead, and really, really appreciate everything you've done for the board and for our city.
Thank you so much. You have no idea how much it means. And as you know, your family has been a trailblazing example as well. And I am eternally grateful, because this has been the opportunity of a lifetime. And I intend to continue because, quite frankly, I don't know how to do anything else except healthcare. So that is either a good or a bad thing, but thank you, Mr. Mayor, means the world. And you have put together a fabulous team. And I'm also grateful that you've prioritized public health. Speaking of someone who is encountering major environmental wobblers and others in this community, anything that I can do, I stand ready. Thank you so much. And to the board.
Thank you. I'll let you guys get back to regularly scheduled meeting. Thanks a lot.
Thank you. Wow. Okay. Let's try to make this very emotional for me. But thank you. And, you know, tremendous, tremendous hug. So, is there anyone else at this point? I'm going to move on to a couple pieces of business, but up to you. Any comments? Okay, here we go. Our second piece of business is your pre-reading materials contained previous minutes. Is there a motion to approve minutes?
Move to approve.
Second. I'll second.
Thank you. All in favor, aye.
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 Opposed? Abstentions? Motion carries and the meeting minutes have been approved. We received a request and it was in your pre-reading materials from Dr. Bart Irwin, CEO of Family Health Centers, of 3 reappointments of Family Health Center board members. As you know, for the code, we have there's a request in the bylaws that we approve the recommendations or review the recommendations. You have those bios. Is there a motion and a second to confirm these appointments?
So moved.
Thank you. Second? All in favor? Hands up. Opposed? Abstentions? Motion carries. The Family Health Center's reappointments are confirmed.
Thank you.
Thank you. Are there any other actions that we need to vote on? Hearing none. Any other comments, first from board members, followed by any other community advisory board members on events or organizational notices or anything else? Are there any?
Heidi, I have one. Family Health
Yes, sir.
Center is going to open its Iroquois immediate care tomorrow, and we're happy
Yay!
about that. Yeah, we hope it's a small immediate care, but I think it will help alleviate some of the pressure and demand for services at the Iroquois site. So that's exciting.
You are wonderful, and please express to your board members, and of whom I can brag that one is retired from UMass, for just a continued focus on healthcare access in lower resourced areas. Appreciated enormously.
I'll pass that message on.
Thank you. Any others? Okay. As you know, there's no August meeting. You're on vacation. The next board meeting will be September 4. Please mark your calendar at 8 a.m. Any additional information will come from the new chair, Dr. Bautista-Cervera. And we look forward to that. And if there is no other business, then with great humility and respect, the chair adjourns the July board meeting. Thank you, thank you, thank you. And it's impossible to kill me, so I shall return as an obedient
so much.
board member.
Thank you.
Stay and be well, and I'll see you in the fall.
Thanks for
Thank
your
you.
work, Heidi. Thanks
My
for your
pleasure.
devotion to the
Thank
Thanks,
community.
Heidi.
You
Thanks for
got
all
it.
you've done, Heidi.
Thank you all. Bye.
Thanks, Heidi.
Thanks.
Thank you, Heidi. And
Yeah.
congratulations to the new chief strategist, health strategist, Connie Mendel, and the new director, Dr. Single.
Mhm.
Yes, so happy, so happy.
Thank you.
Bye-bye, folks.
Bye.